Hi, my name is Robert McCarran, Professor and Vice Chair of Psychiatry at the University of California, Irvine, and Co-Director of the Train New Trainers Primary Care Psychiatry Fellowship, which is a collaborative program of both UC Irvine and the University of California, Davis. Thanks for your interest in our program. Over the next few minutes, in addition to describing our Train New Trainers Primary Care Psychiatry Fellowship, or TNT PCP Fellowship, I'll tell you what drove both my co-directors Shannon Sue and I to start this innovative educational program. Our TNT PCP leadership and faculty are focused on significantly expanding and optimizing the collective psychiatric workforce throughout California and beyond. Up to 65% of all mental health care delivery in this country is delivered in the primary care setting, not by psychologists, social workers, or even psychiatrists. For various reasons, many patients in need of mental health care conditions like depression, anxiety, substance misuse, chronic pain, sleep disorders, and eating disorders are unable to get successfully referred to a mental health provider. Primary care providers like internists, family medicine physicians, pediatricians, nurse practitioners, and physician assistants serve as the de facto mental health care providers in this country. Unfortunately, many have not received sufficient training in this particular area of medicine and often feel the pressures of seeing a large number of patients in a short period of time. The UC Irvine, UC Davis TNT PCP Fellowship provides training in primary care-based psychiatry and helps PCPs diagnose and treat the most common types of psychiatric disorders found in the primary care setting. Put another way, TNT PCP graduates feel more comfortable and experienced while providing primary care-based psychiatric care to those who have common psychiatric conditions. It's also important to emphasize that our faculty teach these fellows how to train other providers in their clinic or region. Essentially, with this unique training program, we squarely address a growing mental health workforce shortage by educating those who deliver this care the most, primary care providers. The UC Irvine UC Davis TNT Fellowship is a year-long program designed for health professionals working in a busy primary care or other healthcare settings. The curriculum has been developed and is taught mainly by dually trained physicians in family medicine or internal medicine and psychiatry. Our TNT PCP Fellowship faculty understands the demands of working in a busy healthcare setting with often limited resources. TNT PCP fellows are able to work full-time and participate in the fellowship during non-clinic hours. Upon completion of the program, graduates will receive a certificate of fellowship completion by the UC Irvine Department of Psychiatry and Human Behavior. There are three core curricular components during the 1 year of training. First, each fellow will attend 2 intensive weekend learning sessions. Fellows learn core topics such as how to do a psychiatric interview and effective screening and treatment of mood, anxiety, pain, and substance misuse disorders. There's an emphasis on addressing chronic pain in the context of psychiatric illness. The second core component includes 2 interactive learning sessions with our TNT PCP Fellowship faculty, each month held at noon or in the evening. Fellows receive over 45 CME units. Lastly, each fellow is also paired with a faculty mentor with whom they meet monthly, whether in person or via electronic medium, to discuss an individualized learning plan. After 3 years of training over 150 fellows, we know this is a sustainable model to provide clinically practical information in the area of primary care psychiatry and chronic pain management, while meaningfully expanding the psychiatric workforce in an effective and sustainable manner. The following are post-TNT PCP graduate outcomes. First, dramatic improvement in overall psychiatric clinical knowledge. Second, decreased provider stigma toward those who have mental illness. Third, improved recognition and treatment of depression, which is currently the #1 cause of disability in the United States. Fourth, decreased overall opioid prescribing. And 5, more comfortable and effective with treating common conditions such as depression, anxiety, and somatic symptom disorders. Our curriculum is published in both textbook, ebook, and handbook form for further study. Our fellowship faculty is made up of state and national leaders in education, healthcare policy, and healthcare delivery. All of our faculty are clinical experts in the delivery of primary care psychiatry. Along with our fellows, many of our faculty are actively involved in multiple exciting regional and statewide mental health related projects. The TNT PCP Fellowship provides much needed training in primary care-based psychiatry. Please visit the TNT PCP website to find scholarships and funding opportunities which support this important training. On behalf of our TNT PCP leadership and faculty, thanks for listening. Please let us know if you have any questions or are interested in joining our TNT PCP Fellowship. Thank you.